But you chose to shut down programs in the middle that have resulted in hundreds of thousands of children dying in the last few months. I find that abhorrent, and few Americans have ever had such a devastating and disasterly impact.
Since the cuts, Boston University has been running a mathematical model of their likely toll. The model estimates that more than 300,000 people have died already. 2/3 of these are children.
In a dim clinic room in North Kivu, a sealed plastic box sits untouched on a steel tray. It's a post-rape medical kit, the kind that saves lives within 72 hours. But this one was never used. In January 2025, the US government quietly canceled its contract to ship 100,000 of these kits to Congo. No press release, no warning, just silence and a locked storeroom. Weeks later, UNFPA confirmed only 13% of sexual violence survivors in North Kivu received HIV prevention treatment in time. And for the rest? Infections, pregnancies, and a fear that never leaves. The kits were ready, but America wasn't.
In the health center of Beni, a nurse opens a dusty cabinet. Rows of HIV prevention kits? Gone. The last shipment arrived months ago. Since then, over 67,000 cases of rape have been recorded across eastern Congo. One survivor says,
"This woman says she was asleep when men entered her home. She says that since the rape there has been pus on her genitals, but that she was ashamed to talk to a doctor. She has now received medication, but many more have not."
She waited 3 days before speaking to a doctor. She was ashamed. By then, it was too late. UNFPA confirmed only 7 out of 34 health zones in North Kivu had any supply left. Just 13% of women seeking help received post-rape HIV medication within the 72-hour window. For the rest, there was nothing but pain and silence. The kits were part of a standing contract between USAID and a medical supplier. It was terminated overnight in January. For decades, USAID was more than a funding agency. It was the operating system behind global response. Data, distribution, early warnings. USAID didn't just send money, it made action possible. Then came the cuts. In Trump's 2025 budget proposal, foreign assistance spending dropped by almost 85%. Suddenly, clinics couldn't pay staff. Supply chains broke. Medical professionals across Congo, Uganda, and Sudan were let go. Oxfam warned over 1 million people in the region could lose access to essential health services. In Goma, a hospital administrator wrote, "Our beds are full, our medicine is gone, and the world stopped answering our calls." Aid groups scrambled to fill the void, but UNFPA reported a $35 million shortfall just to cover Congo's emergency kits. The collapse didn't stay in Congo. USAID funded infrastructure across 120 countries. Its sudden absence shattered fragile safety nets far beyond Africa. According to modeling by Boston University, 300,000 people have already died due to the aid cuts. 2/3 were children. The biggest blow fell on HIV response. PEPFAR, America's signature HIV relief program, was suspended with a 90-day stop order in January. The result? UNAIDS now expects up to 2.9 million additional HIV-related deaths by 2030. The WHO warned, a new HIV pandemic is not unthinkable. It is likely if the US doesn't restore its funding. One diplomat said it plainly. When America pulled the plug, the lights went out for half the world. And in the quiet that followed, the message was deafening. You're on your own.
The cuts weren't a surprise. They were signed. On January 20th, 2025, President Trump issued Executive Order 14169.
It froze all U.S. foreign development aid for 90 days. But the damage began immediately. Within 2 weeks, the contract for 100,000 rape survivor kits bound for Congo was canceled. No replacements, no transition. At a press event in March, Trump said, "We've spent too much helping others. It's time to help ourselves first." That same week, Secretary of State Marco Rubio announced the dismantling of USAID. Over 5,200 out of 6,200 programs were shut down. Remaining operations were folded into the State Department, stripped of independence. Critics say the cuts disproportionately targeted programs focused on women, reproductive health, and LGBTQ+ services. One leaked memo estimated 200,000 children per year would go unvaccinated against polio. Another, 1 million cases of severe malnutrition left untreated. But there was no public funeral, no official goodbye, just locked doors, abandoned inboxes, and hospitals waiting for packages that would never arrive. USAID wasn't shut down overnight. It was left to die quietly.
In New York, they marched with signs that read, "Bring back USAID." In Kinshasa, children waited behind hospital gates, watching for trucks that never came. Since the shutdown, global aid groups have raced to fill the vacuum, but they lack the reach, the systems, the signal America once sent, that even in chaos, someone still shows up. Today, entire regions in Africa face a widening HIV crisis. Programs for polio, malaria, and maternal care hang by threads. And while America debates border walls and tariffs, its humanitarian influence quietly fades. Monica Harding, a UK lawmaker, warned, "It's not just the money. America built the architecture everyone else relied on." In the end, USAID wasn't just an agency. It was a promise now broken, not with fanfare, but with silence. And across the world, the silence is still spreading.